Motherhood is a very beautiful phase in a woman. Unfortunately, there's a lot of changes that comes with being a mom. My name is Lilian Mumina. I am a clinical nutritionist. We are going to talk about some of the changes that come about after childbirth. Pregnancy comes with a lot of weight gain that is expected, and unfortunately, after giving birth, the weight does not go away as fast as we expect it to. You see Akina Beyonce, Kim Kardashian, you see all the celebrities losing the weight instantly, and you're like, why is it not happening to me? Come on, that is not normal, that is not healthy. Do not have those expectations. Remember that it took you 9 months to gain the weight. Give yourself at least 9 months to lose the weight. Work on making sure that you and the baby are well fast. The body adjusts to making sure that you are going to produce enough. Your hunger hormones will be stimulated so that your food intake is increased to make sure that you cater for energy, calories, and micronutrients that are needed for the production of breast milk so that the baby can have adequate supply. Even the society is expected to make sure you have enough food to take up so that you can produce enough milk. It is not the time to diet. This is not the time to even fast, to avoid micronutrient deficiencies that will bring other complications. The second common change is usually low sex drive. After childbirth, your estrogen levels drop. This brings about vaginal dryness. You might even be feeling like, okay, I want my man and all this, but you cannot because you're dry down there. Again, there's a lot of fatigue and tiredness. You can be mentally, physically drained. You can be emotionally drained because motherhood is work. You can always get someone to assist with taking care of the baby so that you can sleep a bit. Be intentional, plan for these dates, and also talk to your partner so that they can be understanding and they take you slowly. If you had a vaginal birth, maybe you had an episiotomy, so there's a lot of wound healing going on down there. When your partner is on board, it is usually easier for you to transition into it. Try as much as you can to engage mentally, physically, emotionally to your partner so that it improves the sex drive. Then we have hair loss. Your hair is expected to start thinning the first 3 months because again of the drop in estrogen. During pregnancy, you had all this bouncy hair, your hair was full, that you've given birth, and then hair is falling down, you're getting depressed. Don't get depressed, it will get better. Just make sure that your dietary intake is as combined and as varied as it can be. You take care of your protein needs, iron, calcium, folate, because the estrogen level usually normalizes at time. The hair loss is not supposed to be permanent. So if you're shedding too much, you might be having a protein deficiency. The levels of calcium, collagen, and all these proteins that are tasked with hair and nails and bones usually go down. Most women usually complain of back pain after pregnancy. I usually say it is malnutrition that has not been addressed. After childbirth, there's a lot of losses and a lot of nutrient demands. The body needs to be well replenished. Increase your intake of broth. You can always do a collagen supplement, a protein or a protein shake supplement. You can talk to your physiotherapist that they can also help you with massaging to improve circulation so that the bone area and the skeletal system is well maintained. Another thing is teeth loss. It is not normal. It is a deficiency. Your body is screaming, telling you, no, we need more calcium, vitamin D3, more vitamin K. All these vitamins that are responsible for calcium utilization and absorption. Increase your intake of calcium-rich foods like in a dairy, vegetables. You can always do a calcium supplement. You can always do a vitamin K supplement. Make sure that you go to the sun, bask when you're breastfeeding the baby, get some vitamin D3 on your skin so that you can activate the calcium and it is transferred to the active sites like the teeth. The other change that comes about after childbirth will be the change in the shoe size. It is a surprising thing to many because it is not talked about. No one tells you when you're going for clinics that you're going to have to change your shoe size. Maybe the medications that you are given when you're giving birth, the injections, the IVF and such things, you're supposed to urinate them. You can lose them through the sweat. Protein is the nutrient that is tasked with maintaining fluid balance in the body. If you're protein deficient, which is common in a lot of breastfeeding moms, your fluid balance will be off. Some women get acute kidney disease during childbirth because of the fluid losses, so you become severely dehydrated. Your kidneys function is altered negatively. Talk to your physician. It can be something that you're laughing about and your kidneys are struggling. The other thing that comes after childbirth is usually moods. You become angry. Some women go through postpartum depression, especially if you're a new mom, because motherhood can be overwhelming. As a new mom, no one tells you how hard it's going to be. People will tell you about the labor expectations, the labor pains, but no one really tells you about the new motherhood phase. The sleep deprivation, the mood changes, the tiredness, the fatigue. To some people, it can be a bit overwhelming. If you are confident, you can share. If you're not confident, there are these support groups on social media. Currently, you can share as an anonymous. Share your concerns. It is always good to understand that you're not in this alone. It is something that is happening and it will go away. It will get better. The GI changes. And most women usually experience constipation because of fluid losses, of dehydration, and because of the breast milk. Breast is 90% of water. In a kamua, it will take up the water from your cells that the body can produce milk for this baby. Increase your fluid intake. If you are taking 2 liters when you're breastfeeding, you need to take at least 3 to 4 liters. You don't get dehydrated, and this does not affect negatively your food movements in the intestine. Another thing you can also do about constipation is increasing your intake of fiber-rich foods like fruits, vegetables, soluble fibers, cucumber, gourgets, okra, spinach. You can always do a probiotic supplement. You can increase your intake of mala. You can do a glass a day to help in the movement of food in the colon and the intestines, and this will reduce constipation. Another thing is hemorrhoids. During childbirth, the pushing, the pressure that comes with that can cause hemorrhoids for some women. You can always use ice cube, increase your water intake to prevent having pressure when you're eliminating your digestion waste. Another change that comes with motherhood is temporary vision impairment. This can be because of various reasons. Number one, it can be because there was hemorrhage in the nerves and the veins in the eye area. Some women report blindness immediately after childbirth, but this resolves itself when the pressure goes down. The system is able to repair itself. Making sure that you increase your intake of vitamin A rich food is very important. The red, yellow vegetables, the carrots, the pumpkins, the squashes, tomatoes and oranges, so that you can give your vision the boost that it needs. The other change that comes with childbirth, flabby and soft stomach. It gets better with time. When you're cleared, but you can always do some mild exercise to turn up those areas. But again, when you're working out, you also need to make sure that you do exercise that are diastasis friendly. During pregnancy, there's a lot of tearing up of the muscles in the stomach areas, and when you start working out, you need to factor in that so that you don't worsen the tear, you improve it. Also on that, there's a lot of skin changes that come with childbirth. We have stretch marks. You can have like a serious acne flare. I usually say the acne is usually due to micronutrient deficiencies. Zinc, vitamin D3, calcium, they are essential nutrients in the skin component. So when the levels go down, you will experience breakouts. Again, there's a lot of hyperpigmentation because of the hormonal imbalances, but this is supposed to subside with time. It is important to take care of your body when you're pregnant, but it is more important to take care of your body after childbirth, because you're taking care of your body for you and the baby that you're breastfeeding. And apart from that, how you feel about yourself is very important if we are going to continue with the exclusive breastfeeding. So as a new mom, it is very important, it is very necessary to look for a support system. You can always look for someone to talk to. You can always share with a close friend. So make sure that you take care of your well-being. When you're cleared by your gyna or you're cleared by your practitioners to go and work out, look for a gym trainer that understands the changes that come with pregnancy, the changes that come with childbirth, so that they can walk you through the recovery process of your body. Be yourself, love yourself, and let's take care of our babies. Please consider subscribing. If you found this video useful, please give it a thumbs up. If you have experienced any other changes that you have not talked about, you can write it down on the comment section down below.